So I'm here with Sarah today, and we're going to look at kind of some pain reflexes and how it relates to exercise and movement. And most of the patterns that I'm going to show today are normal patterns, and I'll let you know when the pattern becomes problematic. So I'm going to do some pre-tests, muscle tests with her. Hold, and she's strong in the shoulder, and she's strong in this shoulder. So if I have her put her hand up, and I've got a little toothpick here, and I'm going to do a little testing with her. Let me do this first, hold on. So she's going to push, and she's strong. She's going to do push this way, and she's strong. So now if I give her a little poke, her arm should inhibit to pull away. So if I poke, hold, that muscle goes weak. It should. It's trying to get away from the painful stimulus. That's called a flexor withdrawal reflex. Now, it could be in anywhere. So if I do this, if I test her this way again, hold, she's strong. Unless I poke her on the back of the hand, and then I push, and she gets weak. Her brain basically is just saying, let things get strong or weak to try to get away from the painful stimulus. Okay, the question becomes is, how does that affect, how long does it last, number one, and how does it affect how the muscles are responding when we're exercising? So I'm going to go ahead and retest her here. Hold, and I'm going to retest this because, I want to make sure you're good. Everything's strong. So let's go back and test this one. Ready? Hold, strong, and strong. So she's kind of, that was not much stimulus. So I'm going to give her a little more stimulus this time, and she's going to pull away, but I'm going to go back to the shoulder girdle, hold, and she actually goes weak in that one also. So the more I give her, the more stimulus, the bigger the pattern spreads. In fact, if I do enough stimulus, hold this side, she's good. But if I continue to do it, poke her, poke, 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 bring this arm up, hold, and she gets weak. It's literally radiated to the other side. So I could wait here. I do this with clients all the time for demos. I could have her lift, I could have her walk around, whatever. In fact, I'll move around just a little bit. So she's walking around a little. I could have her, as I said, lift and go do some exercise, whatever I want her to do. She's going to come back. Let's test the pattern. So let's go to this side, because this is the biggest radiated side. Ready? Hold. And she's still weak. And this is, hold, still weak. The pattern still exists. Okay, so the brain is still kind of thinking there's maybe a potential problem there, and that pattern sticks around. I'm going to give her a weight here, which she's going to hold kind of in the area that I was kind of poking her with. Now, pressure against the painful receptor will negate, hold, and she's strong. So there's a temporary blocking of the signal. It could be that we're lifting weights and we're feeling good because we're blocking the signal. Well, that only is really relevant because I poked her in the hand. If I poke somewhere else, she's not going to be able to lift or hold the weight in her feet or in her knees or anything else. So the place that the receptor is irritated will kind of dictate what kinds of activation and inhibition patterns that she gets. So something that happens on this side that's painful can radiate over and have pain on this side or loss of strength on this side as well as on this side. So until I reset her, she is going to be, hold, strong here, because that's not part of the pattern. Weak here, because that's still part of the pattern. Again, it's a pattern. All right, so I'm going to quickly reset her. So I'm doing a little stimulus to her, and I basically reset the pain pathway. Hold, and then we'll go back to here, and she's good.